Welcome to Dental Sleep in 5, Episode 12. Does objective oral appliance calibration need to be complicated and expensive? I have no vested interest in any appliance, device, or technology. I maintain a sleep disorders dentistry practice, conduct research, and provide educational programs. Our facility is accredited by the ADSM, and our facility and all programs follow AADSM guidelines. So you'd like to objectively calibrate your oral appliances, but repeatedly dispensing HSTs can be complicated, time-consuming, and expensive, right? Hell no. In fact, remote patient monitoring has been simplified down to putting a ring on it. With a simple ring paired to a phone app, a clinician can remotely monitor sleep architecture and cardiovascular response to therapy. Multiple night monitoring is facilitated because they have the ring at home and they just wear it each night. This helps to deal with night-to-night variability associated with one-night studies when we're trying to establish an optimum jaw position with an appliance. We can evaluate oximetry, heart rate, and even look at a histogram. The patient can use the ring during the day to evaluate exercise variables. And there's more. Patients can review the results daily as well. This helps to incentivize them to comply with therapy. Both efficacy and compliance is established with the data the ring provides, and it's comparable feedback to what is currently obtained with PAP devices. But there's even more. PDAC approved HCPCS codes are available. So for those of you that want to work with Medicare in the US, I would suggest reaching out to Jeff Wyscarver and consulting with him. He was involved at the grassroots level and he'll give you appropriate guidance so that you don't get in trouble with this. Remote patient monitoring involves remote monitoring of a chronic condition. Obstructive sleep apnea is a chronic condition. There's 3 essential components: a sensor at home monitoring the patient over a period of time, remotely receiving and analyzing the patient data, and making a clinical decision based on the data collected. And all of that can be accomplished with this ring. Patient awareness fosters, in the short term, using the clinician circle, modification of bad habits, like better sleep hygiene, encourages initial compliance through a gamification type of thing. It encourages engagement. They're watching their results, they're watching their improvement, they're really motivated to get involved. And this is a motivating factor for many people. And they use the gamification and many learning channels online for this type of reason, providing badges and so forth, is a sense of encouragement. Well, over the long term, when the patient has to give the Circul back to the clinician after their appliance is calibrated, they may feel they don't want to do without the Circul because they've become accustomed to having access to that information and understanding what it means. So it's inexpensive enough that they could actually buy one for themselves, and they wouldn't be spending any more than they would for a normal wearable device that they would get at one of the big box stores. Ongoing maintenance of the modification. So if they've modified habits, they can make sure they're not falling off the wagon because they get instant feedback if they have a bad night's sleep. They become prompt to call the office for advice or for an appointment if their sleep report is showing that things are going south on them and they can't figure it out. Encourages ongoing compliance and engagement on the patient's side. Here is a 4 consecutive night study, myself. The first 2 nights, you can see that I had an ODI of around 25, which alarmed me. And when I looked, I was spent 1.45% of the evening below 90% saturation the first night and 1.81 the second night. And when I looked a little bit more closely, it looked like it may have been related to REM, or maybe it was position. I don't wear a positional aid, I just wear an appliance. So I decided to switch things out and I went to a different appliance. I went to an appliance that kept my jaw closed, did not allow me to open up, and look at the results the next 2 nights. 5.1 and 7.9. And the first night, no time under 90% saturation, and the second night, less than 1% under 90% saturation. So I was quite pleased with that change. So in this particular case, I'm guessing it was really more to do with my jaw dropping open than it was to do with REM sleep. Easily evaluate various jaw positions on a night-to-night basis, home calibration, and you can see the progress. Supine versus non-supine sleep. You want to try a positional aid out. You want to add elastics to prevent jaw opening and not have the elastics, and you can immediately get the feedback on your computer at the office and the patient on their phone at home. Altering vertical opening dimension. Well, you can alter dimension and get immediate feedback. Instant feedback on sleep hygiene and lifestyle habits and changes there. Excessive drinking, eating late meals, weight gain or loss. So they're going this journey and they know the rules of engagement. They can actually get immediate feedback as to how well their sleep is doing as they're losing weight, or if they've allowed themselves to put on some weight, they can actually see it translate out into poorer sleep, motivating them to get the weight off and keep the weight off. So we can't underestimate the value of instant feedback to the patient in a manner that has never really been available before. The Circul is a high-resolution pulse oximeter, Bluetooth capable, rechargeable, and water resistant, yet it's simple and inexpensive. It motivates and encourages compliance. It objectively documents optimum calibration. It eliminates concern of night-to-night variability for ease of use and over a number of nights, as long as you want. And it documents ongoing efficacy and compliance. I don't know, but dental sleep medicine just got better as far as I'm concerned. Thank you and sweet dreams. 'Cause if you like it, then you should have put a ring on it. If you like it,